Hi, my name is V. Levitt. My summary is going to be on the theory of narrative and collaborative approaches. The newest therapy on the block are presented as postmortem counseling approaches. This is based on the work of Australia and New Zealand-based practitioners Michael White and David Epstein in 1990. Collaborative approaches was developed by Harling Anderson and Harry Gouldishin in 1988 and 1992 from Texas, and Tom Anderson in Norway in 1991. They are grounded in social constructionist theories that examine societal communications such as media, images, movies, environmental norms, mainstream customs, and behaviors that influence individuals on personal matters such as gender, culture, race, religion, and economic rank. These issues affect some individuals' personal sense of self and the development of problems. They also affect the relationships and how they form or are formed towards an individual's understanding of experience of oneself. Postmodernist therapists do focus on the client's strengths and abilities. The counseling relationship is between counselor and client should be respectful and kind. Narrative treatment plans begin by meeting the person and separating them from the problem, and also understanding oppression issues in society. The therapist begins by the description of who the person or people are separated or distant from the problem. The model focuses on the person and his or her hobbies, the interests, their career, or other activities. Problem-saturated narrative describes how the problem is affecting the person, including the level in which it affects the person, such as their personal level of emotions, behaviors, identity, and their personal narrative. Perhaps their relationships and the levels of any conflicts. Therapists also focus on their broader circumstances in their lives, such as their work, their school, their hobbies, and other activities as well. Unique outcomes in the areas include times, contexts, relationships, and even if they are not the problems in their lives, everything is important and discussed. If they are affected by the problems, then the therapist will ask, what does the individual do to make the problem less upsetting? The next focus would be on the dominant discourse, such that the issues, if any, on cultural or ethnic, religious, or gender, sexual orientation, family or community, and school, and other social discourses are perceived problems, and the problems they find the problems and possible solutions. Local alternative narrative of identity, self-narrative, is intended to find the problem that affects the person or the family member's identity. Local discourses with the client's preferred identity narrative would be regarding the problem or issues being faced. The case conceptualizing refers to the problem-saturated stories, which is overly exaggerated, blown out of proportion stories about the problem. Unexpected outcomes or sparkling events means that the client will sometimes have a good outcome or some other action that will turn out from the negative out of the problem. Dominant culture and gender discourses is what the therapist will focus on to find the problem or issue. Local and alternative discourse could be some other issue in the client's head that keeps interrupting their life. Collaborative and case conceptualization. The focus of the sessions is who is talking about the problem. Client's definition of the problem, sometimes including the family members whose experience and view the definition of the problem. The ample system definition includes school, work, friends, or other circumstances. Social constructionists of problems is also discussed if it is necessary for the individual. Describe the inner dialogue and narrative of the problem of their circumstances. Research and evidence-based narrative and collaborative counselors have managed more of the qualitative than quantitative investigation about their approaches on this type of therapy. Quantitative research on postmodern therapies have focused on clients' lived experience and its effects on their issues and highlighted the client's experience over researcher-defined methods of successful therapy. A notable exception, Finnish psychiatrists have used qualitative and quantitative methods to study their open dialogue approach to working with psychosis and other severe diagnoses for over 20 years, producing significant evidence for their model's effectiveness. They report they have successfully eliminated chronic cases of psychosis, with most clients returning to normal functioning within 2 years. Their work is an excellent evidence-based approach for recovery-oriented approaches to treating severe mental health issues. Regarding the diverse populations, it has been benefited from the model in many countries. This therapy focuses on the diverse cultural, social constructionists. Therefore, it takes into account the client's environment. In treatment planning, the phases of postmodern therapy begins with meeting the person, and getting to know the person as a whole, including relationships they hold in their life. The client may have school, work, family, and other outside activities that the therapist needs to get to know as a whole. The client may be involved in other community activities, so details will help the therapist and client create the narrative. Therapists should be open-minded and understanding of the client's personal views on life. A therapist also needs to be aware of the separation of the person and the problem. They are seen as two different entities instead of one person with the problem. The therapist would then be able to investigate the problem of dominant discourses, of local discourses that the client may be struggling with, in order to receive better results in the therapy sessions. There are external questionings that are asked in order to build a relationship between the client and the problem or issue as a separate entity from the client. Problem deconstruction was created to listen to the client in order to help trace the effects of dominant discourse and to empower the client to make more conscious choices about which discourse they will allow in their life. There is also a practice of mapping and landscaping of action of identity. Consciousness is based on the narrative theory of Jerome Bruner. Mapping the problem in the landscape of action and identity or consequences refers to a specific technique for the harnessing unique outcomes to promote desired change. After the problem has been identified, then there is an enacting preferred narrative in order to look at a new way to relate to the problem. Scaffolding conversations is also used. Scaffolding refers to move clients away from that which is familiar to that which is a novel. Learning is inherently relational, requiring adult to structure the client learning in ways that make it possible for them to interact with new information. Permission questions are also asked during the session. The therapist will also use narrative for reflecting the team practices, so will also be used. This is used to get more clear information from the family members to join in and give their version, and the client may rebuttal if he or she wishes. Leagues are used in the therapy so that the therapist can also use letters and certificates to reinforce the emerging new narrative in the new client's life. Diverse populations. This is a good therapy for the diverse populations that have been benefited from the model in many countries. This therapy focuses on the diverse cultural, social constructionists. Therefore, it takes into account the client's environment. Thank you.